Hello everyone, my name is Dorsa and today I will be talking about transcranial magnetic stimulation in the treatment of major depressive disorder. So, before we get started, what is a major depressive disorder? MDD is characterized by both poor mood and abnormal brain activity. Reduced levels of brain-derived neurotrophic factor, or BDNF, which typically promotes healthy neurons and synaptic plasticity, are a significant result. Patients with depression regularly have lower levels of BDNF, whereas antidepressant medications and treatments such as TMS boost the expression of this hormone. Impaired adult neurogenesis, especially in the hippocampus, is another significant cause. Long-term stress and sadness slows down the development of new neurons, which could impair mood and memory. A lot of patients have high levels of cortisol, which might harm the hippocampal region and further inhibit neurogenesis. Lastly, inflammation is a significant factor. Cytokines like interleukin-6 and TNF-alpha, which disrupt neurotransmitters and brain plasticity, are frequently seen in greater concentrations in depressed people. All things considered, depression is best viewed as a condition of diminished brain control and plasticity, which helps to explain the potential efficacy of stimulation-based therapies like TMS, Villanueva 2013. But what is TMS? Cerebral neurons can be depolarized non-invasively using TMS, a scientific method that has a variety of effects on brain cells. This approach can be used in conjunction with other neurocognitive and neuroexperimental methods and provides both temporal and spatial resolution. The U.S. Food and Drug Administration has approved prefrontal TMS therapy, a neuromodulation technique to treat MDD in patients who are not responding to medication. This therapy is repeated daily for 4 to 6 weeks. This method excites neural cells by means of electromagnetic induction. Treatment-resistant depression has been successfully treated with TMS. Patients with serious depression have response rates to TMS ranging from 50 to 55% and remission rates between 30 and 35%. Rizvi and Khan 2019. So, what are the physiological effects of TMS? Patients with significant depression have been found to have dysregulated dorsolateral prefrontal cortex activity, which leads to symptoms typical of the illness. TMS effectively treats behavioral dysregulation in individuals with significant depression by targeting the etiology of depression with high-frequency electromagnetic induction over the left DLPFC. Rizvi and Khan 2019. The antidepressant effects of transcranial magnetic stimulation can be explained by several significant brain effects. TMS modifies cortical excitability at the most fundamental level. While low-frequency procedures can lessen overactivity in other areas, high-frequency stimulation enhances activity in the left dorsolateral prefrontal cortex, an area that is usually underactive in depression. In addition to these local effects, TMS alters the way different parts of the brain communicate with one another. The prefrontal cortex's top-down control over limbic regions, such as the anterior cingulate cortex and amygdala, is strengthened when it is stimulated. This brings networks that control mood and emotional processing back to equilibrium. TMS encourages neuroplasticity even more. Repeated stimulation can enhance adaptive pathways and diminish maladaptive ones, resulting in a long-term potentiation or depression-like effects. Lastly, TMS affects the chemistry of the brain. It raises levels of BDNF, regulates glutamate, and enhances the release of dopamine and serotonin. These modifications promote hippocampus neurogenesis and synaptic development. All things considered, TMS aids in re-establishing the neurochemical balance, connection, and plasticity that are disturbed in major depressive illnesses. Enrico Ganelli et al. 2025. So, how does TMS actually aid with depression? A 2023 meta-analysis by Vita et al., which pulled together almost 20 clinical trials, found that TMS really does make a difference for people with MDD, especially when medication hasn't worked for them. Robert Gregory, Vita et al. 2023. Unlike medication, which acts systematically, TMS works at circuit level. Samani and Carr 2019. What's even more encouraging is that a good number of patients went beyond improvement and reached remission, meaning their depression symptoms largely disappeared. For many people who have already tried multiple medications without any success, TMS provided that extra push that finally got them well. From a patient perspective, TMS was generally well tolerated and often perceived as more acceptable than trying any further medications. Some trials have also documented improvement in cognition and quality of life overall. Importantly, the analysis suggests that TMS can help some patients move from a partial antidepressant response to full remission. Early symptom gains also predict later remission, which makes TMS a valuable addition in real-world treatment-resistant depression. Vida et al. 2023. Although there are some critiques and limitations, TMS has strong evidence for treating depression, but there are things to be considered. One of the biggest issues is durability. While many patients respond in the short term, follow-up studies show that sustained responses rate drop over time, with about 2/3 of patients still improve to 3 months, but less than half maintaining benefits at 12 months. Related to this, there's no clear agreement on maintenance strategies. Some clinics use clustered or boosted sessions to help keep symptoms under control, but there's no actual standardized protocol on how often or how long these should continue. Another challenge is the wide variety of protocols: high frequency left-sided, low frequency right-sided, bilateral approaches, theta burst stimulation, deep TMS, and even accelerated regimens are all in use, but not all are FDA cleared, and the evidence comparing them is mixed. Sham TMS can also produce symptom improvement, which raises some concerns about placebo effects. And finally, practical barriers like cost, insurance coverage, the time commitment of daily sessions, and limited access to trained providers mean that many people who could benefit from TMS are unable to access it. Trapp et al. 2024. However, there are some very bright future directions for TMS. Looking ahead, there are several directions for TMS in treating depression. One area of progress is accelerated protocols. Instead of daily sessions stretched over 6 weeks, some studies have tested 5 to 10 sessions each day over just 5 days. Results are striking, with over 70% of patients improving and more than half reaching remission. This approach could be especially valuable when rapid treatment is needed, such as in suicidal patients. Another advance is theta burst stimulation. This method delivers the treatment in just 3 minutes, yet clinical trials show it's just as effective as the traditional 30-ish minute sessions. Because of this, ITBS is now FDA approved and is becoming more widely used. Personalization is also key here. Using brain imaging, researchers can precisely target the prefrontal area most connected to hyperactive mood circuits, which boosts treatment response. And in the future, TMS is expected to be integrated earlier into treatment plans, working alongside medication and psychotherapy rather than being reserved only for treatment resistance. Levitt 2023. Overall, TMS has proved to be very successful for treating MDD and still has a long way to go in terms of being researched. Thank you for listening.